you going to be paying the tax? Are you going to be paying the huge tax for not having health care? Do you know how much the tax is? Or charge, or fine, that's what it is. Do you know how much the fine is? One owner car guy, oneownercarguy.com, and this here video is about healthcare. Actually, Obamacare, the Affordable Care Act. It's for my Canned Soup website. I've kind of got an article written on there, a web page or such. Go to cannedsoup.com. Up top, you'll be able to find the healthcare link and stuff, and go to that. I want your opinions. I want your comments. Comment down below. What's your experience? What do you think? And all that. Before I get going on that, I want to say a word about my last video. This will take about 45 to 60 seconds. If you're not interested in that, don't watch this part of the video. My last video was about some lady who hit me. She rear-ended me. Bam! Hit me just like that. I've had all kinds of different reactions on it. And you know, my day was not going so well. I'd fought with my car to get it uploaded and pictured and washed and detailed and tinkered around with. And the rain, it's crazy here, and it's crazy right now in California. It's cold. Well, I got it finally done. This lady backed into me and hit me. And I got worked up. She looked like she's gonna take off and hit and run me. Oh man. And you never know when someone backs into you, like she's gonna jump on me and say it's my fault. I don't know. I got worked up. And then I spilled my milk. Oh God, there's worth crying over spilled milk in your car. So I got worked up. Some people saying, you're a butthole, you were mean to her. Well, I wasn't trying to be mean. She ran into me. What about me? I didn't look to get hit. I didn't hit no one. She did it. I had somebody say, well, you were a little late on the horn. Give me a break. I didn't know she was gonna back up. I was still halfway in the street. She'd back up and hit me. Not my deal. So whatever, I got all calmed down. I bought her a stinking coffee, and you know, I feel bad, you know, that she had a rough day, but I had a rougher day. It's like today. I'm here. It's Christmas Eve. They closed the gym. I'm at my security trailer. I can't get to my other yard. Stinking truck is all broke down and I can't leave. It's snowing. I can't have wipers. So whatever. If it happened today, I'd be angrier. That's the whatever on that. So, healthcare, here we go. Okay, so about healthcare. We all need healthcare. If we don't need it now, we're gonna need it at some point. Healthcare ain't cheap. Honestly, I'd heard so much talk about Obamacare and Affordable Healthcare Act and all this. And everything I've been hearing from news type stuff seemed kind of good, but everything everybody said seemed really bad. So I did a lot of researching this year. I don't know if you know, are you gonna be paying the tax? Are you gonna be paying the huge tax for not having health care? Do you know how much the tax is? Or charge, or fine, that's what it is. Do you know how much the fine is for not having health insurance? It's about $685, I believe. $685, that's a lot of money. And when you think about that, people that don't have health insurance, it's gonna be a drain on the economy if they don't have the money to pay for the health care they need. My ex, a long time ago, made some big problems and got my health insurance canceled. And in the meanwhile there, I didn't deal with that. If I had a problem, I would go pay for it out of my pocket. I think I'd much rather have health care. So now I have health care again because of this. Also, my other ex, Samantha, she had pre-existing conditions or what have you. She'd had like gallbladder surgery and all this kind of different stuff to where I have getting my booty wet too. It got snow and ice on the Volvo. Ice and snow. No, actually, I chipped it out of my freezer in that office trailer there. All ice all over it. I'll get people complaining about that. You put ice on your car? I can't believe you put ice on it. Total cool Days of Thunder, Fast and Furious car there. Okay, so the healthcare. Put it down in the. I want to hear your thoughts on it and all this. Put them down in the comments below. Tell me what you think. What's your experience with it? As far as I go, what the experience is it's way cheaper. I can't believe how much I got health care for. I got a really good plan. I could have got a little bit better. I had choices anywhere between $11 and $197. My ex, who could not get health care and was on a ban list and got turned down everywhere she tried, she got health care for about $11 a month. A lot of people, if they're under a certain income level, get health care for free. Even if you have health care now, even if you just think you got it all set and you don't qualify for anything, you should check out Healthcare.gov. God, I sound like a commercial for it. you should check out Healthcare.gov. It saved me big money, like a $228 a month tax credit. Basically, my health insurance for the entire year is going to cost me about $1,250. $685 for a fine or $1,250 for the healthcare. I'm taking the healthcare. That's the way to go for sure. What did the Affordable Care Act or Obamacare do? Well, it made it to where people can't get turned down and can't get rejected in the healthcare plans. It made it to where they have to put everything online. When I looked through all the different plans available to me and how much it was for a visit or an emergency visit or an MRI or this or that, or if I had a kid, because you never know, I might get pregnant. It's amazing. It's all right there. It's all easy to read. If you go to Healthcare.gov, it'll shoot you over to your state marketplace or whatever, where everybody that's a provider has signed up and has these plans on there. Very affordable. Same plans that they had. I got Kaiser. I went to the Kaiser website and looked up all their plans, got to know that, and then I went through Healthcare.gov, which shoots you over to the marketplace, which then you go through there to get the Kaiser. Same plans. Same damn, it's perfect. For $200-something less a month. It's neat. Check it out if you don't have health insurance. Honestly, there's no reason. Anybody who doesn't have health insurance and has, I can't get it, bull crap. That's a bunch of crap. You're an idiot. You just need to look. You need to go out there, enter some stuff in there. It's a done deal. You've got health insurance. I can't afford it. Bull crap. If you can't afford it and you can't afford $11 a month, I don't understand that, number one. But number two, if you can't afford $11 a month, then basically it's taken care of federally, and they get you on a Medi-Cal, Medicaid, Medicare, I don't know which one, what it is, but it's Meta something, and you got health care. You just got to fill out the stuff and not just show up at the hospital emergency room and get. How it works in Montana is these hospitals, people that don't have health insurance, they go to the hospital, the emergency room, of course. The emergency room pumps these bills up 10 times and then bills the crap out of the people. They end up getting bad credit. The hospital then turns around, writes it off, and the state gives them subsidies and stuff for it because they're out the money. Well, they're not really out the money. When my ex had to go get a MRI, I believe it was a boom, 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 boom thing or whatever to check out some stuff, it was like $2,900. If you have health care plans, it's from like $100 to $250. So one problem, that's just the scan thing, the whole visit and everything, she was like $4 grand or something in that one little thing, plus the other visits leading to and going from that. Excuse me, getting over a cold. I don't go to the doctor for a cold. Lots of people go to the emergency room. What happens to all them bills and stuff? The taxpayer pays them in the end. That's the cold hard facts. And with this new healthcare thing, it does put the burden on the people, and people need to get the healthcare. You've only got 6 weeks. That's all you've got. You got 6 more weeks, and then you'd have to get it through a full price thing. You can still get healthcare, but till the end of January, I believe it is, you can check it out and get some federal tax credits for getting it, and go through their marketplaces, which are really neat. And the marketplace, you'll get a better rate. So I think you can go 3 months out of the year uninsured, and then the fine kicks in. So get it now. It's easy. It's cheap. You've got about 5-6 weeks before the state marketplaces close. So get that done. Check it out. Throw your comments down below. What do you think? I don't care if you agree with me. If you don't agree with me, tell me your opinion. I want to hear. I want to learn. Go to my site, cansoup.com, and up there underneath like other pages or whatever, you'll see the healthcare thing, and go there, check out that page. There's all kinds of info. That's what I'm making this video for. I've got all kinds of cars for sale. If you haven't seen any of my cars, you should be seeing my cars. People calling about them right now, but I'm making a video. That fool reviews on my website. That fool reviews on my website. Both Sevilles. This might be sold today. That is sold. That is sold. Wagoneer and the Range Rover, I just haven't got up yet. All kinds of stuff. Your Mustang, Escalade coming up. I've got another dually over here. I got a Blazer over here. Man, I got all kinds of new stuff, and I got a couple more coming. Got a new 5th-wheel trailer. Anything you need. I got it. The Red Cross Disaster Relief Van is sold. The Cabriolet is coming up. You get what I'm saying? All kinds of cars. So throw in your comments down below all about healthcare and how you hate it or how you love it, or if there's really no way it can be more expensive for you when basically everything's through a state marketplace. Now, if it's more expensive, it's because you're getting older and because the rates are going up. When I X'd out of it, so to speak, 9-10 years ago now, I was paying $353 a month or something for me and my ex. Seems cheap now when the average plan is about $340, $333 just for me. $388. It was $388, I think, just for me. So it's definitely went up. It's not because of the Affordable Care Act or anything. It's because I'm 10 years older, and it definitely goes up. I think my dad's like $700 or $800 a month, but he's like 64 and a half, and in like a couple months here, Medicaid, Medi-Cal, Medicare, whatever the care, Medi it is, takes over, and his health care will be free, I believe it is, or close to free, which is the way it should be. After you pay into the system all these years, you get that old, it's the way it works. And that's the same exact thing that you're dealing here with the Healthcare.gov. You go through there, they've set it up and they've made it a bit more honest. Is it a perfect system? No, I don't think it's a perfect system. Nothing's a perfect system. I'm sure they'll come up with tweaks and fixes that make this a little better and this and that. Repealing it and making it not happen, that's ridiculous. I believe that everybody should have to pay to have some kind of health insurance or be able to pay for the services they're going to need. And really and truly, with the kind of thing we're dealing with, expensive as it is, you're not going to be able to pay for the kind of things you need with these kind of things. Like you need a end-of-life surgery or something, you catch some virus or something, you could be out hundreds of thousands of dollars. It's just not what the average person has, so you've got to make some kind of means and controls on that, I guess. And this is the best they came up with. I'm not an Obama fan. I didn't vote for Obama. I don't think that people should like disparage and talk bad against somebody that's the president and stuff. We should kind of lay off a little bit maybe and keep a little bit of our American respect and face. But I mean, the guy's kind of screwing stuff up. Yeah, that's a fact. But I'm glad that the one thing is finally any politician took healthcare serious. Almost every other country in the world has it. I'm glad we have something now. So for me, it worked out. For my ex, it worked out. I'm a small business owner. I'm not able to spend big money on big things, but I know that if you don't have enough money to get health insurance, something's wrong with you and you're spending your money wrong. Plain and simple. $11 a month? Come on. If you can't afford $11 a month, 36 cents a day, 38 cents a day, something's wrong. Something's wrong. Thanks for watching. Have a great day or not. Whatever it is, wherever you are, throw your comments down below. We'll talk to you. OneOwnerCarGuide.com, BeaglesPocket.com, Loud Road. This is just where I happen to do it because I've taken a video of the snow. We'll talk to you.